Lymphatic drainage is one of the primary treatments for lymphedema or swelling in the breast and the chest. My name is Kelly. I am a certified lymphedema and cancer physical therapist. And in this video, let's go step by step through a lymphatic drainage routine to help move fluid for breast and chest swelling and lymphedema. So we're about to dive right in, but if you have any new symptoms or pain, always check in with your doctor for safety. It's also best to do this routine directly on the skin if you're able to, and this is something that can be done daily as a routine. So let's get started. First, we want to start with 4 deep breaths to help stimulate the deeper lymphatic structures. This will increase flow of lymphatic fluid through the large vessels of your abdomen and your trunk to get back to the heart. So first, we want to place our hand on our abdomen, gently pressing inward for some pressure. Take a nice big breath in through your nose, feeling your belly expand into your hand. Pause at the top and then slowly exhale out through your mouth. Then we'll repeat this 3 more times. So big breath in and out. Breath in and out. Last one, big breath in and out. Now we're going to get into the lymphatic drainage routine. If you think about drawing a line down the middle of the body and then across at the belly button level, those 4 areas of the body go to different lymph nodes or different sections. If someone has a healthy system, we know that if we have swelling in the right breast or chest, it goes to the right lymph nodes in the armpit, and then same thing on the left, and then the lower legs, the legs go to the groin lymph nodes right where your sitting crease is. And so if we're thinking about the breast and chest, we're trying to guide all of the fluid towards the lymph nodes in the armpit. If someone has more severe lymphedema or swelling on one side, yes, some of the fluid will still go towards the lymph nodes on that side, but a lot of the lymph nodes will also move across to the opposite side. We know with newer research, we used to say to have the fluid go down towards the groin lymph nodes, but the new research is showing that that doesn't actually occur and the fluid still sticks in that region or across to the opposite side or even up into the lymph nodes around our collarbone or clavicle. So for this video, we're going to be a little bit different than I have in my past videos, and we're not going to go down to the groin, although it's still okay to do. We're going to focus on staying on the upper body only. Now this routine is going to be based on if someone has swelling on one side of the body or one side of the chest or breast, but if someone has swelling in the both, then really what we're going to do is to make sure that you guide all of the fluid towards the lymph nodes on those sides, or maybe you do work your way down. So we're going to start with one side at a time though. I have a hair binder on my wrist because this is the side that we're going to be focusing on that is swollen. So that may vary from one person to the other, but follow along with the swelling side based on this. So after we've done our deep breathing, we want to stimulate the lymph nodes in this area. And so we're going to start with the head and neck lymph nodes. I like to start with the lymph nodes that are right around the collarbone or clavicle. Take our hand directly on the skin. With the full hand at the base of the neck, we're going to do 8 to 10 circles in either direction, right there to help stimulate those lymph nodes. We can also stimulate the lymph nodes that are right below the ear. So we're going to take our fingers, split into 2, put on either side of the ear, whole hand on that lower or upper jaw below the ear, and do 8 to 10 circles around that area. And that can be done on both sides of the head and neck, again, if we have swelling on both sides. And then we're going to stimulate the lymph nodes in the armpit. So take our hand fully in the armpit, directly on the skin, and doing 8 to 10 circles in the armpits. And we always want to make sure that we do both sides, no matter if someone has swelling on one side or both. So after we've stimulated the lymph nodes, then we're going to move on to moving the lymphatic fluid. Again, I'm going to be basing this off of swelling on one side, and that swelling may be more mild or so. If someone has really severe swelling, this may vary from person to person, so it really is best to work with a certified lymphedema therapist for personalized guidance. And if someone has swelling on both sides, then really what we want to do is all the fluid stays on each side or going down, versus what I'm going to be teaching might be going across to the opposite side. So again, work with a therapist near you, or check out the other videos on my channel that talk about each situation individually. So when I think about the fluid in this area, I try to draw a line down kind of in the middle of the chest or breast area, and everything on the outside of that can go to the lymph nodes in that region. Everything on the inside, we can go to across to the other side. Or if you have healthy lymphatics, you just move everything towards that same side. So what we would do is I'd like to think in 3 more sections: above the chest or breast, in the middle, and then down below. And then you may also have some on the side as well. What we're going to do up top, we can either move our fluid gently towards the lymph nodes if it's a healthy lymphatic system, or if it's not, if you've had lymph nodes removed, we can move across to the other side. Again, directly on the skin. And we want to make sure that we at least get across the midline into the other lymphatics. And from there, if they're healthy, they'll just take it and help move it along. 3 to 5 strokes across, guiding that fluid. If someone has a pocket of swelling up there, just spend more time on that region, guiding it through. Then with the next section, again, depending on where the fluid is and if someone has lymph nodes removed or not, we can either guide the fluid towards the lymph nodes in the armpit if you have healthy lymphatics, or if you have congestion or you don't have any lymph nodes remaining from surgery, then we can move our fluid across to the opposite side. Again, making sure that we're just at minimum getting past midline of the body onto the other part of the chest. Spend as much time as you think you need. Some people will just do 3 to 5 times. Some people will spend a couple minutes there if they have a lot of fluid. And then last, we're going to focus on below. So we can either move the fluid up and around towards the lymph nodes or on the outer part of the body. So we know we have lymphatic vessels on the side. We can even work on the side of the chest up towards lymph nodes. It's not wrong to try to guide the fluid down towards the inguinal lymph nodes in the groin, but it'll be interesting to see the newer research how there hasn't been any signs that the fluid actually goes that direction. So we're going to be guiding towards the normal lymphatics unless there's a certain situation where someone will need personalized guidance for. Or again, if someone has a lot of congestion, a lot of swelling, we can move across to the opposite side. So 3 to 5 times in each area, up to a couple minutes in each area, guiding the fluid out of the chest, either towards the healthy lymphatics in the armpit, or if someone doesn't have the lymph nodes remaining or has a dysfunction there, we guide towards the healthier opposite side. If someone has swelling in both sides and it's healthy, you go to that same side. Or if we really need to, we can go down towards the groin lymph nodes as well. So it's going to vary, and that's exactly why it's good to see a certified lymphedema therapist in your area. If you're looking for one, if you go to www.clt-lana.org, you can search for one in your area. But otherwise, that's the sequence for lymphatic drainage for the breast or chest area for lymphedema or swelling. If you're looking for lymphatic drainage to the arm or the head neck area or the full body or others, you can find all of these videos on my channel for whatever part of the body that you need. Otherwise, I hope you all found this video helpful, and I will see you all in the next video. Thanks, everyone.